New Canadian research has found a direct link between cannabis use in pregnant women and an incidence of autism. The study found that children whose mothers reported using marijuana during pregnancy were more than 1.5 times more likely to have autism than children who were not exposed. Researchers looked at 2,200 Ontario women who gave birth between 2007 and 2012 and said that they used cannabis while pregnant. The research was done by the Ottawa Hospital, Cheo-Bourne, Ontario, and the University of Ottawa. Joining me now with more is Dr. Doreen Elchar, co-author of the study. Good morning. Thank you so much, Doctor, for being with us.
Good morning.
First of all, give us your thoughts on what the research found.
Sure. So you summarized it nicely, but our research was really looking at maternal cannabis and neurodevelopmental outcomes after having looked at it previously in obstetrical outcomes last year. And we noted the increase in the diagnosis of autism that was made in children born to mothers who had consumed cannabis during the time of our study period, which was about 10 years when you look at the follow-up period of when they were born and then to how long we followed them.
So were the researchers more interested in looking at why autism occurs or what happens if mothers use cannabis during pregnancy? What was your starting point?
Yeah, so for this study in particular, it was around neurodevelopmental outcome. We've previously looked at what happens to pregnancies, and we found an increased rate of preterm birth and some other obstetrical outcomes which were affected, like birth weight and other placental issues. So we generated more work from that existing interest to now look at the babies and the infant outcomes. So this is focused on the neurodevelopment and brain. So autism was one, but we also looked at other intellectual learning disabilities and found less of a significant association.
So there are health warnings out there about using cannabis during pregnancy. Is your feeling that those warnings are not being followed?
It's hard to know right now. And as you mentioned, yes, Health Canada, Society of Obstetrician Gynecologists, we still recommend against use because we don't have enough evidence to talk to our mothers about what it could mean. I think that we probably are seeing similar rates and maybe a little bit more upfront patients telling us about the use because of legalization. So that we may be seeing. However, we haven't looked at the numbers yet, but we plan on doing that now to see what the numbers are post-legalization in 2017.
Right. I guess I'm wondering why pregnant women would use cannabis. Mm-hmm. Is it because it is legal now? People think that it may not be harmful during pregnancy to their baby? So
certainly that's one. There's always the impression that if something is legal, it may be okay, but we know that that's certainly not the issue with other substances like alcohol and smoking. So I use the same analogy in terms of why they use it. Certain moms do need to use it because they've used it for other medical issues, for pain management or dealing with other symptoms. So certainly we have to be aware of and helping those patients with other other medications that they will need to have to deal with their medical issues, as well as there's some people who use it recreationally still, as well as for potential help with nausea.
So this was a big study. What do you hope to do with the results?
So this is one of the largest studies in more recent times published. We hope that this will help sensitize and help our care providers counsel their patients about some of the risks. And certainly we know we need to do more studies and continue looking at the cohorts of patients as this was from 2007 to 2012. So we need to look at more recent data and continue doing linkage. And we also need to look at whether timing of use and other substances affect the outcomes, as well as different types of cannabis. As you know, there's many different forms that can be used.
Doctor, thank you so much. Really appreciate you being with us this morning on this study. Very important.